So what I'm going to do is I'm going to introduce a technique called a hip bump. Now, the concept behind this was developed by one of my mentors, Gail Malloy. And what we're looking at is a very deep socket. So when we do long axis traction on the joint, we're not really getting to the true mobility of the joint. You're maybe doing a joint reset. But for those of us who did it for a long time before the hip bump, the effects didn't really change Faber a ton or internal rotation a ton. So what she had thought of was that on the greater trochanter itself, if you bump the hip, it'll cause a spin, because you realize it's a ball and socket joint that has a spin component. So what might happen is that the hip itself is anterior laterally in the socket, which is where we get some of the labral irritation from, and it just sits anterior lateral. That could be tone from the psoas, pulling it up into that anterior superior part of the hip joint, but somehow a suction is created and you lose that spin. So this is a manipulation not spin like that, this is a manipulation in order to improve spin. I stress that you should explain this to your patient before you just go ahead and start bumping their hips. You need to do some really good education beforehand. So I explain it to the patient that way. I usually have a model or something so they can see it. We'll have done a measurement of the hip and we'll have noticed that there's a stiff hip. Now in this point, it could be a stiff Faber or internal rotation. It doesn't matter. What the term for it that Gail came up with was UFER, unrestrained femoral internal rotation. Internal rotation itself is controlled eccentrically by the lateral rotators. If it's unrestrained, you're always feeling those lateral hip rotators are tight. So this technique actually helps with that. What you do is you basically, what I like to do first is internally and externally rotate the hip to make sure I'm on the greater trochanter. I take my hand and I just do a little bit of a cup just to get rid of some of that soft tissue slack, or to create some slack in the soft tissue. Get rid of some of the tension. When I was taught by Gail, you find the tightest band of lateral rotators, and that's the angle you choose to use. The technique itself is a bump to the hip. You explain to the patient what's going on before you do it, and you retrain the motion that was restricted afterwards. So what you do is you line yourself up, bump the hip. You can do a couple if you felt that that wasn't as effective. Bump the hip. And then look to see if that resets it. So then you work on that internal rotation. Or because we're working on push off on gait, if internal rotation's a component, gently push back into me. And we work on extension, internal rotation. Extension, internal rotation. And you do that a few times and you say, this is just like, imagine when you're walking and your hip coming back. If you felt the psoas was still a little tight and reset, you can just do a stretch right there. If you bend the knee too much, you're going to bring in rectus femoris though, so you got to be careful. Then go ahead and lay in your stomach. We can recheck, if we checked beforehand, the internal rotation or the Faber, whatever was restricted. And then you can also do some mobilizations with movement of that hip. Go ahead and push out into me. Good. And relax and do some mobilizations with movement. So that is the hip bump, and it just works on taking that hip that might be off center, doing a quick stretch in order to get the hip reset to recenter. Open up a window for that hip and then you do your neuromuscular reeducation, definitely getting it connected to this push-off part of gait.